Why is the national debt so very important that you're trying to kick 16 million people off their health insurance, but increasing the national debt doesn't seem to matter if you're cutting taxes for billionaires and billionaire corporations?
Well, first of all, a huge portion of this goes to family-owned businesses that are pass-through entities that are below that level, Senator, and I am sure you share my goals of Main Street prosperity.
You know, I'm glad to do tax cuts for people of modest means. The question I'm asking is, why does the deficit not matter to you? We're talking about knocking 16 million people off their health care, but it matters not, it does matter to you if we're knocking people off health care, but not.
Well, first of all, that figure is overstated by 5.1 million. That is amount not attributable to provisions in this bill.
So you think it's okay just to knock 10 million people off their health care?
Well, first of all, let's set that straight. Work requirements account for 8 million.
This wasn't just a policy clash. This was a moment where the mask slipped. Senator Warren corners the Treasury Secretary with a question every American can understand. If Republicans care so much about the deficit, why do the numbers only matter when it hurts families, never when it helps billionaires? And when she exposes the myth about Medicaid covering undocumented immigrants, the entire defense collapses in real time.
Thank you, Mr. Chairman. So I want to ask about the Republican big, beautiful bill, which will knock about 16 million people off their health care coverage and cut programs that keep groceries cheaper for millions of families in order to try to pay for about $4 trillion in tax giveaways that are mostly going to be sucked up by millionaires, billionaires, and wealthy corporations. So, Mr. Bessent, Secretary Bessent, I'd like to start with a very simple question. Will this bill increase or decrease the deficit?
They're varying scoring on that, Senator
You're
Warren.
the Secretary of the Treasury, so I'm asking you, what is your view? Will this bill increase or decrease the deficit?
It is my view that over the 10-year window, it will decrease.
You know, do you have anybody who agrees with you on this?
Yes, ma'am.
Let me ask my question.
Okay.
Every credible independent expert agrees that Trump and the Republicans' big, beautiful bill would add trillions of dollars to the national debt and would not even come close to paying for itself. The nonpartisan Congressional Budget Office, the Penn-Wharton budget model, and the Yale Budget Lab all agree on this, and they're looking at 10-year windows, thank you. So do the Conservative Tax Foundation and Committee for a Responsible Federal Budget, conservative groups. Even Elon Musk and the Wall Street Journal are criticizing the bill for ballooning the national debt. The only people who are saying publicly that it's not going to add to the national debt are you, Donald Trump, the Republicans in Congress. Do you have an independent group that has put forward numbers that disagrees with all of these conservative groups and disagrees with the Wall Street Journal on this?
Well, Senator, interesting to see you aligned with Elon Musk, but if I add...
You're no more shocked than I am.
If we want to take the full congressional budget scoring, they predict, and I don't agree with their methodology, they predict a $2.4 trillion deficit. But
okay, so the answer to the question is yes.
But may I finish? They include but they've also scored $2.8 trillion in tariff income. So even in Washington, D.C. math,
okay, so,
in Washington, D.C. math, that is a $400 billion surplus.
Okay, so let me make sure I understand. This bill, you admit, will increase the deficit by $2.4 trillion, but you think there will be another bill and another set of agreements that somehow materialize, haven't materialized so far, don't have any statutory authority, but that will make up the difference. So the answer to the original question, will this bill increase or decrease the deficit? I think you just said it will increase. This bill increases the deficit.
No, I want to use all the CBO scoring, and you can't take one without the other. I don't agree with the CBO.
One is the law that we are scoring, the bill that is in front of us. We don't have a tariff bill in front of us to score. Mr. Secretary, let me go on to the second question. You have said that government spending is, quote, out of control. You have also called government government spending, quote, unsustainable. In fact, in the name of fiscal responsibility, you're working with the Republicans on this big, beautiful bill to pass the biggest cuts to Medicaid and the Affordable Care Act in American history. So, Mr. Secretary, help me understand here. Why is the national debt so very important that you're trying to kick 16 million people off their health insurance, but increasing the national debt doesn't seem to matter if you're cutting taxes for billionaires and billionaire corporations?
Well, first of all, a huge portion of this goes to family-owned businesses that are pass-through entities that are below that level, Senator, and I am sure you share my goals of Main Street prosperity.
You know, I'm glad to do tax cuts for people of modest means. The question I'm asking is, why does the deficit not matter to you? We're talking about knocking 16 million people off their health care, but it matters not, it does matter to you if we're knocking people off health care, but not.
Well, first of all, that figure is overstated by 5.1 million. That is amount not attributable to provisions in this bill.
So you think it's okay just to knock 10 million people off their health care?
Well, first of all, let's set that straight. Work requirements account for 8 million of CBO's claim number. Again, we're creating an economy that promotes and rewards.
It's clear, Secretary Bessent, that you don't want to answer the question.
No, Senator, I am answering it.
No, you're not.
And what I want is for Medicaid to be used for mothers and children as it was meant, not for 1.4 million illegal aliens, not for able-bodied people.
Medicaid is not used for people who are not documented. Mr. Chairman, I just want to say here, the part that troubles me the most is that the Secretary is deeply worried about the deficit and is willing to knock 16 million, or as he says, merely 11 million people off their health care. Matters so much, but it doesn't matter so much if you're cutting taxes for billionaires. Then it's okay to run up a big deficit. I think that's wrong.
We do have some differences of opinion. However, we also have a time crunch. I'm going to ask the remaining senators, and including any of mine who show up, to stick with the 5 minutes, please.
There are hearings where you expect disagreement, and then there are hearings where you watch an argument unravel because the facts simply don't bend the way someone wants them to. From the very first question, Warren forces Secretary Bessent into a corner built out of arithmetic, and arithmetic, unlike politics, doesn't negotiate. She asks the basic budget question: does the bill raise or lower the deficit? A neutral, clinical, nonpartisan question, something the Treasury Secretary should be able to answer without blinking. But blinking is exactly what happens, because the bill does increase the deficit, not by a little, but by trillions, and every respected model says so. Liberal institutions, conservative institutions, university labs, budget experts from across the spectrum. And when Bessent tries to dodge with talk about varying scorings, Warren cuts straight past the fog. She keeps demanding the one thing political messaging hates: clarity. Not projections, not wishful thinking, not future legislation that doesn't exist, just the reality in front of them. And this is where the viewer sees something important, something you don't learn unless you pay attention to how Washington debates actually work. When someone starts invoking hypothetical revenue from plans that aren't written, scored, voted on, or even agreed to, that's not budgeting. That's storytelling. It's the same technique people use when they say they can afford a new car because I'll probably get a big raise soon. It's a hope, not a number. And Warren calls that out for what it is. The bill increases the deficit. Bessent finally acknowledges it, just not cleanly. He tries to wrap it in the idea that tariffs from a future bill will somehow rescue the numbers. The problem? That's not the bill being debated. And that's why Warren won't let it slide. In Congress, you score the law in front of you. You don't get to add imaginary laws to make the math look better. Then the conversation shifts and gets even more revealing. Warren points to the trade-offs this bill makes, cutting healthcare for millions in the name of fiscal responsibility while simultaneously delivering tax cuts to people at the very top. She wants the audience to see the contradiction. If the deficit is the emergency Republicans claim it is, why do the sacrifices always fall on the same people? Why is the solution always taking something from those who have the least? This is where political priorities become clearer than any spreadsheet. When confronted with the numbers, Bessent pivots to a familiar talking point, that Medicaid is supposedly being used by undocumented immigrants. It's an argument that's been repeated for decades, but collapses under a single fact. Medicaid, by law, does not cover undocumented individuals except for emergency life-saving situations. It never has. That's federal statute, not opinion. And the second Warren says it, everything shifts. The defense he was leaning on evaporates because it wasn't built on data. It was built on a misconception. She doesn't just swat it away. She exposes how often misconceptions like this get inserted into budget debates to change the subject, redirect blame, or justify cuts that wouldn't survive if the public saw the real numbers. This moment becomes more than a debate about a bill. It becomes a lesson in how narratives are used to sell policies. Warren forces a confrontation not just with the details, but with the priorities behind them. The debate stops being about Medicaid or tax cuts or tariff projections. It becomes a question of who Washington is willing to defend and who it's willing to sacrifice. And by the end of the exchange, that question is sitting on the table with no good answer from the secretary. If deficits are so dangerous, so urgent, so catastrophic, why are billionaires always shielded from the consequences? What we just watched wasn't confusion. It was a strategy dragged into the light. Using the deficit as a weapon to cut healthcare and ignoring it the moment tax breaks for the wealthy come into play. Warren didn't just challenge the talking points, she dismantled the story built around them and revealed the values hidden underneath. So now it's your turn. Do you think this was really about fiscal responsibility, or was the deficit crisis just the excuse? What do you think this bill was truly designed to do, and for whom? Let me know in the comments. I want to hear your take.